So the first time I had sepsis was in the summer of 2023. I wasn't very well, and NHS 111 and my GP kept sending me to A&E as they were worried that it could be sepsis. And I went about 5 to 6 times, and the hospital kept telling me I was fine and just to keep taking the antibiotics for my kidney infection. And then they did say, but I should come back, like if it got worse. I then got urine retention and had to have a catheter fitted. And 2 days later, I was very unwell. So my mum took me straight back to A&E, and they did blood tests and decided they were going to admit me. So they gave me IV antibiotics and fluids, but then they changed their mind and sent me home and told me to come back the next day. So I really wasn't very well. So my mum took me back in earlier, and they put me on the same day emergency care unit, which wasn't very well set up for people that had sepsis. So then finally they said that I really needed the hospital bed, and thought to admit me. So it took me 16 hours to be admitted, and they never actually told me that it was urosepsis. It was only my GP that saw my bloods after and was like, yeah, you had sepsis, because all the levels were so high. I was in hospital for 9 days, and it was really scary because obviously it was my first time experiencing it. It took me ages the first time. I was obviously really weak and literally had been bedridden for 9 days, and I'm in a wheelchair anyway, so, and an athlete, so not doing anything was worse because obviously my body's so used to being up and being active. And mentally it was quite traumatic, the whole experience of it, and not knowing like if it would happen again, because it didn't really tell me anything like what I should do. Like I had a follow-up with my GP within a week, but again it wasn't that helpful. Yeah. I'd heard of sepsis, but I didn't really know anything about it. No, I know a lot more now. So the first time I didn't actually have a fever, but I was really, really shaky, very confused. Like it just didn't feel right. And I had slurred speech, but the first time I had less symptoms that sort of indicated sepsis, but the more I've had it, the symptoms have become more like sepsis symptoms, if that makes sense. So that was, the first one was like August time, and then the second time was October, but I was actually in America, so it was even more traumatic. Thankfully I had really good health insurance. So again, I started to feel unwell, and I get quite recurrent kidney infections. So again, I was sent to A&E, and they said, oh no, you're fine, but you should get good health insurance because you never know when it might happen again. And within 2 days of arriving in America, I started projectile vomiting and had a really high fever. So I was rushed into hospital, and they were absolutely fantastic. Like, it was a completely different experience. They immediately knew what it was. I had IV antibiotics, I was admitted, all the fluids, everything. And they then proceeded to give me antibiotics for 2 weeks and a midline in my arm to fully clear it up. And yeah, the experience was completely different. It was scary being in a hospital a million miles away from home. And of course, because I was British, everybody kept going, why are you here? And I had to tell the whole story every time. But yeah, you could see doctors whenever you wanted. It was just completely different. Fitted time-wise really well. So I stayed in for 5 days, and then they gave me 2 weeks worth, but we were there for the whole 2 weeks. So the midline literally came out the day before we flew home. And then they contacted like my GP surgery, where they tried really hard to, and were like, she needs more bloods just to make sure when she comes off the antibiotics that the levels don't go up again. And they did loads of scans, and they thought that I had a kidney stone, which might have caused the infections, which would make sense, but the hospital here disagreed. So that wasn't until March last year, so there was a massive gap. So those antibiotics that the American hospital gave me worked really well. But this time we had to call an ambulance because I was completely out of it. Like, I don't really remember it. I felt like I was going to die. I was projectile vomiting, and like I couldn't keep my eyes open. So that experience, I can't tell you very much about it. Apart from that, I was in hospital for about a week, and again I was given IV antibiotics. So I've got a catheter as a result of the urine retention, and when they change the catheter, they don't always do a very good job of it, and we think it was related to the catheter change. Quite a lot of the infections have been related, unfortunately, even though I was on prophylaxis antibiotics when they changed it. Like, I know that I was put on a ward. I remember this bit because the hospital roof was falling down, so you can't really forget that. And they had to get rid of me as quickly as they could because they needed to move the other person in the ward to my bed because their roof has started to fall down. So they probably sent me home sooner than they would have liked. But obviously the NHS it's really tricky. And I'm quite a hard case because obviously I normally have carers at home, which is my mum and dad, and they can't stay. So it kind of makes it a bit more difficult because I don't really want other people helping. I'd rather it be my mum just because I'm used to that. And I find it quite difficult as well because the toilets and stuff aren't necessarily disabled friendly, as in you can't get an electric wheelchair in them. So it just makes it that bit harder. And almost once I'm like over the fever and the antibiotics are doing their job, I'm almost better at home because that's just natural for me and I've got everything I need. So the next one was just after returning home from Paris, so it wasn't to do with a catheter change. I think I may have had an infection in Paris and I've got rescue antibiotics, and I maybe didn't quite take them as quickly as I should have taken them because obviously I was in Paris and I didn't want anything to ruin my experience. Thinking back, I should have probably just taken them, but because I'd just been to the Paralympics, I still had my nails done and everybody was asking, and I felt like I was treated like a VIP because everybody knew that I'd won a medal and everything. Again, my symptoms were very similar to when I was brought in by ambulance, and I was seen straight away through like the triage bit and put in the ambulance queue, and then was given IV antibiotics and everything much quicker. So what I forgot to add was when I went into hospital in March in the ambulance, we changed hospitals because the paramedics said that Wexham Park would be much better. So we went there and they were completely different. They immediately knew it was sepsis and acted, which obviously made a big difference. Yeah, so they all said that it was probably a kidney infection or a UTI that had then caused sepsis because it was when they did blood cultures, they were positive. So this one, I remember like being in A&E and like it was so hard to just keep my head up or my eyes open, and I had loads of jumpers on, so they were trying to take the jumpers off, and yeah, I just felt like I was going to pass out, and I just didn't feel like myself at all. I was completely like wasn't making any sense at all. And again, they were really quick. I think I saw a doctor straight away. I jumped the ambulance queue, and they gave me IV antibiotics straight away. But this time it took longer to stop throwing up and for my fevers to settle. The last few times it was quite soon, but my blood pressure had also started to drop the last time, which it hadn't any of the other times before. I think the more times I've had it, it's been a bit quicker to recover. Like obviously you recover and then you have another setback, so it's definitely not easy because I think I've got back to full training and I feel so much better in myself, and then I get it again, and then obviously the whole process takes again, and I don't feel like I'm fully up to where I was before I had it in August of 2023. It's just not quite there. And like mentally, as I said earlier, it's just so traumatic because you just don't know if it's going to happen again. Obviously I've had it 5 times now, and every time I get an infection I'm always worried that it's going to develop into sepsis, and I just don't know because sometimes I'm okay and the oral antibiotics work, and then other times they don't, and there's no reason why, and it just changes so quickly. I can be absolutely fine and then I'm not fine. Yeah, I've spoken to the sepsis nurse through you, who was fantastic. I spoke to them after the case in America, because obviously that was probably the most traumatic out of all of them because I was in an unknown, and she was really, really helpful. And then I spoke to her after the last bout in December, just because I was concerned it had happened so many times, and she was really good at putting my mind at ease and telling me that even if I wasn't sure it was, it's better just to go and get checked than wait and find it is sepsis. I think definitely reach out to Sepsis because they're so helpful and they've got so much knowledge, and like any worries you've got you can just ask and they'll help to put your mind at ease or answer the questions. And obviously your family and friends can be really supportive around you as well. So when I was much younger, I think I was about 3 years old, I started riding with the Riding for the Disabled group. And it was always thought to be like a form of therapy for my cerebral palsy at the time. So I started it, but it turned into much more, and horses were love at first sight, really. And they developed into something very special. And when I was about 11, I got talent spotted in my sport. And then it kind of went on from that. Like I started doing internationals. So I did my first international at the age of 14 and was classified. And then my condition took a turn for the worse in like 2016 time, so I actually got reclassified. So we're classified on the level of impairment and like how it affects us on the horse. And I was reclassified to a grade 1, which was the most disabled of all the grades. And that's kind of where my Paralympic dream kind of took off. And I thought, oh, actually, this is a possibility. Because I started to win a lot, whereas before I wasn't doing very well. And then in 2019, I got selected for my first senior championships, which was the Europeans, which obviously was a dream come true. And I helped the team to win a silver medal. And then in 2023, the year that obviously I had sepsis twice, I got offered the ride on a Fiend, who's owned by Diane Redfern and lives at South Bucks. And she's the most incredible horse. She's actually won 9 gold medals to her name when I got the ride. And I got her in 2023, and then in 2024 I got the amazing opportunity to be invited back onto the world class program, and then it became really real. But actually in March, the ambulance mission that I mentioned was the massive Paralympics GB squad training, and I missed it. So it was when they were doing all the interviews for all the athletes that could be selected for Paris and all of the press and everything, and I was in a hospital bed, so I missed all of that. So sepsis has definitely like stopped me from training and missing out on that sort of thing. And obviously, like I said, it's really hard having a condition, and mine's degenerative as well, but then when you have sepsis on top, it's even harder. And when I'm able to do my sport and train, I kind of focus fully on that and competing, and just try not to worry. Like, it's always in the back of my mind, but the minute I think I'm getting an infection, I take my rescue antibiotics, and touch wood, that seems to be helping as long as I act quickly enough. And I've just got a fantastic new neurologist who's suggesting all different sorts of things, so I feel like a lot more confident now, and she's going to write me a letter that says that I'm low sepsis threshold, which we can just take into A&E with everything on it, rather than having to try and explain it, because obviously when I'm projectile vomiting and mum's trying to explain it, it's quite difficult. So if we've just got a letter, it will hopefully make the process much easier. The main thing is, like, not everybody presents the same. Like, you may not have the typical sepsis symptoms. Like, the first time, like I said, I didn't have a fever, and until the last time my blood pressure hadn't dropped. So the first hospital kept going, oh, you can't have sepsis because you don't have a fever, but you can still have sepsis even though you don't have a fever. So I think my message is, if you really don't feel well and you're really unsure, then just go and get help and just ask, could it be sepsis? It's much better doing that than waiting and going into septic shock. So I've got one of your t-shirts that I'll be wearing riding and going to the gym and wherever I go, in the hope that people will sort of ask why you're wearing it, and obviously be able to share my story. And with my raised profile from the Paralympics, I'm just hoping that it gets sepsis more out there, so more people know about it, because not that many people know. Like, when I said I had sepsis, people were like, what's that? And it's such a horrible condition if not taken seriously and treated quickly, that more people need to know about it. Like, the statistics on it are shocking, and people just need to be more aware of it. So hopefully it gets better sort of press coverage, which will then hopefully help all the patients dealing with it.